Good afternoon, everyone, and welcome back. I see that folks are slowly coming back from their sessions this afternoon. I'm Sanchez Fuentes, the Vice President for National Policy at Start Early, and I'm happy to welcome you all back to our afternoon plenary. Just some quick reminders and a quick reflection as I was hopping around this afternoon. Really appreciate that a lot of the conversation and information that we all have been listening to and engaging with has really been around centering the voice of families and communities, and we'll continue that same thread this afternoon. So a couple of reminders, right after this plenary session, please feel free to join an instant networking. Remember that you can earn points for the summit game. And if you don't know what that is, please feel free to visit the conference website for more information. And in addition to that, you can join a discussion table to talk with attendees about this afternoon's plenary. And so with that, this afternoon's plenary is called Using Innovative Funding Strategies and Equitable Approaches to Strengthen Early Childhood. This session is going to offer a unique perspective from an expert panel of local, state, tribal, and federal leaders who are going to share successes, challenges, and visions for creating program services and supports that center the voices of families and communities. The panel will include a discussion on the potential benefits of additional funding, such as Build Back Better, or even increased funding for MIECHV, and for how children and families and system and program leaders can prepare for implementing this new additional state or federal funding. Our moderator for this afternoon's plenary is Sarah Ritling. Sarah Ritling serves as the Executive Director for the First 5 Years Fund. In her role, Sarah's vision and leadership are propelling the organization towards influencing politics and policy that prioritize and benefit children living in poverty to ensure that they have access to high quality early childhood education opportunities. Sarah has a strong record of bridging the partisan divide to find solutions and build consensus to serve our nation's children and families. And with that, I'm going to pitch it over to Sarah.
Thanks so much, Yvette, for the introduction and mostly for asking me to be here today with the panelists and with all of you. As Yvette said, my name is Sarah Ritling, and I serve as the Executive Director of the First 5 Years Fund here in Washington, D.C. I have the pleasure of moderating today's discussion, and like many of you joining, I am privileged to have a job where I get to spend my days working with a team focused on how to make things better for America's youngest learners and their families. At the First 5 Years Fund, we work to sustain and expand the support for early learning that exists at the federal level and advance new and innovative ways to increase access to high quality early childhood education for children from birth through age 5, particularly those from low income families. Before we hear from our panelists, I'm going to give you a brief overview of the state of play in Washington, D.C. right now, besides peak cherry blossom blooming, that is. For decades, funding for programs that support America's earliest learners and littlest children have proved to be a unifying priority for both Democratic and Republican leaders, which stands true at all levels of government. We saw that just last week when a key House committee held a bipartisan hearing entitled Improving Family Outcomes Through Home Visiting on the importance of reauthorizing the Maternal, Infant, and Early Childhood Home Visiting Program, or MIECHV, before funding expires on September 30th of this year. In a demonstration of the broad bipartisan support for the program, committee members from both sides of the aisle praised the unique role MIECHV plays in improving family outcomes and supporting young families across the country. That's because you have all worked with federal, state, tribal, and local partners to ensure lawmakers understand that when you pair families with trained home visitors, such as nurses, social workers, and educators, the result is healthier families who send children to kindergarten better prepared to learn. We know from libraries worth of research that benefits of home visiting under MIECHV funding reduce maternal mortality and morbidity, improve infant and child health, improve school readiness, decrease incidents of child neglect, and promote family well-being and stability. Now, up until very recently, the federal role in funding early childhood education has centered around a handful of incredibly important programs like MIECHV, which when you think about the size and scale of federal investment in other spaces like healthcare or even higher education is relatively small. Then in March of 2020, as the COVID pandemic began to unfold, we and others began sounding the alarm bells about the catastrophic impact economic crisis would have on the care sector and for families who already needed a little extra help. When President Biden signed the American Rescue Plan into law, it included $120 million for MIECHV to allow states to continue to support children and families and increase access at home visiting programs. Like other programs that received additional federal funding, the federal government did not invent home visiting. MIECHV is designed to give states flexibility in identifying local needs to maximize effectiveness in improving outcomes. States and communities have historically led on expanding access to care and education, and by working with partners and leaders at the federal level, can improve health and education outcomes across the country. And there's a tremendous amount of gratitude to all of you for your work to make sure those dollars are being spent effectively. We'll hear more about that from our panelists who are on the ground doing real work and who get to see firsthand the impact of what this partnership with the federal government and states looks like. I'm going to, housekeeping here, turn it over to our panelists here who are going to share some of their stories, and then we're going to turn it to a little bit of a conversation so we can learn more. So we are joined today by Melissa Lynn Brodowski, who's the Deputy Director for the Administration for Children and Families Office of Early Childhood Development at the U.S. Department of Health and Human Services. We're joined by Secretary Elizabeth Graginski, who's the Cabinet Secretary for New Mexico State. Gary Batten, who's the Chief of the Choctaw Nation in Oklahoma, and Decoria Jones, who's a dedicated parent advocate and leader from South Carolina. With that, I'm going to turn it over to Melissa and we're going to get started.
Great. Thank you so much, Sarah. Really appreciate the introduction. And also just a big thank you to you and the leadership of all the advocacy organizations that worked so hard actually to get those big wins in the American Rescue Plan last year. There's more work that everyone's doing, but just really, really thank you. And thanks to Start Early for this wonderful opportunity. So I'll just say a little bit about myself and ACF, the Administration for Children and Families. I've been there for about 20 years now, which is really kind of frightening when you say it out loud, but my background is in social work and public health. And I actually come to the home visiting field by way of the work that I led starting from the Children's Bureau, which is really grounded in child abuse prevention work and family support. So I take those principles really in the work that I'm doing. And I've been fortunate to be in a couple of different offices across ACF. And if folks don't know about the federal agency Administration for Children and Families, we're the human services side of the Department of Health and Human Services. So just to say that our agency includes a number of offices that you might be familiar with, Head Start and childcare, or certainly the other offices relate to early childhood, but Children's Bureau, Office of Refugee Resettlement, Family Assistance, the range of human services. And it's really about, the vision is really around fostering the health and well-being of all children and families, really through partnerships with states, communities, and other folks in the delivery of human services. And for the Office of Early Childhood Development, we're really the office that oversees the Office of Childcare and the Office of Head Start. We're also home to the Tribal Home Visiting Program, so shout out to those folks here, and also the Preschool Development Grants Program. So just to give you a little bit of context at the federal level in terms of ACF and our total budget, it's about $60 billion, of which a third of it is related to the early childhood programs in Head Start, childcare, and ECD. So that's about $20 billion. But in last year with the American Rescue Plan and all those investments, there was about $48 billion that went to ACF. So certainly a significant amount of money. And what I wanted to flag for you in terms of current issues and priorities, we have a Deputy Assistant Secretary, Katie Ham, who's our Deputy Secretary of Early Childhood Development. And she was brought on, and I've been working with a couple different administrations now, but she's really excited about this historic opportunity. I think folks might have heard on the childcare side, the single largest investment in childcare the country has ever seen came last year with $39 billion that came to support childcare programs, of which $24 billion went for a entirely new childcare stabilization grant program, whose purpose was really to provide funds to states to provide them directly to providers to really support the response to pandemic and stabilize the sector after everyone is recognizing what happened during the COVID. So that money is really helping these providers stay open, making rent and mortgage payments, paying for staff and providers. And then there was another $15 billion added to the CCDF program that really was supporting expanding the availability of the childcare subsidy to even more families, essential workers. So a tremendous investment on the childcare side. And then there was another $1 billion that was added to the Head Start program to really support grantees addressing the impact of the pandemic and response and recovery. And I know I see several Head Start programs and early Head Start too, really moving back towards in-person services, supporting a range of facilities, staff wellness issues, supporting outreach, health and safety, and then also supporting vaccinations for families. So there's been a tremendous amount of work there that Head Start has been leading to really build that capacity with them with those rescue plan dollars. And then finally, with the tribal home visiting program, Sarah mentioned the increase, but there was a $4.5 million increase as well that was added to our tribal home visiting grantees, and really is supporting, as you all know, sort of the innovations in technology, facilitating virtual home visiting, supporting other critical needs to facilitate the work during the pandemic and response and recovery. And so at this point, the key priorities are really related to supporting the implementation and making sure states and grantees have the technical assistance, support, and flexibility to use that money across the country wisely to where the needs are. And there's a tremendous focus on supporting the early childhood workforce right now that we're working on, as we know, as we're waiting for hopeful new investments in the sector. There are a number of things that our office is doing across our agencies. And we also facilitate a number of interagency partnerships. So we're really fortunate to have great partners like maternal and child health bureaus, CDC, other agencies, as well as working closely with the Department of Education. So I know it's just meant to do a little bit of context setting for the federal agency and the office. And I'm just really excited to pass it along because the innovation really happens at the state and local level. So at this point now, I'm going to pass it over to Secretary Elizabeth Groginski, who is always a state in New Mexico and in DC. We've always highlighted the amazing things that she's led in the early childhood space. So turn it over to her.
Thank you, Melissa. And I want to echo your thanks for Start Early and their leadership in putting together this home visiting plenary and this summary, and also to, as you said, to Sarah and all the national advocates who have helped so much during the last couple of years, bring the resources and the investments that we need at the state level to get those to programs that are delivering the services in communities to families and children. So I am Elizabeth Groginski, and I have been I'm the first cabinet secretary here in New Mexico for a newly created early childhood education and care department. The department was actually officially launched July 1st, 2020. And I'm very proud to say that as a state that has 23 sovereign nations within its boundaries, that we also have the first assistant secretary for Native American early education and care as part of our leadership team. And through this department, we brought together programs and services from Department of Health, which was our early intervention program, and a perinatal case management program called Families First, nurses going in to across communities and in homes to help support families in that prenatal to two period of life. And from our Children, Youth, and Families Department, which was our child welfare agency, we brought many of the programs, including home visiting, but childcare, both assistance and regulatory, our family nutrition program, all of our quality supports that supports the entire early childhood workforce, and pre-K. So, and then from our public education department, we brought the pre-K from that department as well. So it was a big job, and only because of the strong leadership of Governor Michelle Lujan Grisham and an incredibly bipartisan supportive legislature was I able to, with my team, able to set up a new department in the midst of a pandemic where families and children and the programs that we delivered, prenatal to 5, were definitely needed, and we're on the front lines and struggling to survive. So we have not only survived, I feel we've thrived as a state, and it is because of the leadership of our governor and the support of our legislature and of the families and the communities around the state. We were fortunate to have a preschool development grant in the early stages, and we had over 2,000 New Mexicans contribute to our statewide strategic plan. We are also fortunate to be a Pritzker state, and so through that planning, we have prioritized home visiting. But it's through the voices of our tribal education directors, our tribal leaders, families, programs, the workforce, we were able to establish a very strong advisory council. And that voice, a transition committee, and so many other voices have helped inform the establishment of this department. And I would say some of the most incredible successes, especially during the pandemic as it relates to our home visiting, when everybody was in lockdown, but families, especially in our tribal communities, still needed formula, they needed diapers, they needed things. We were able to engineer these incredible supply lines. And many of it was through our home visiting programs that were deeply embedded in communities, and we're able to get food and other necessary resources from where they were and to where they needed to be to families. And I just want to give a huge shout out to our 33 home visiting programs that are funded through the state who have just, and we all know this, home visitors across this country have done more, even though they've been doing telehealth and maybe not traveling, they have been doing more for families during these last 2 years than many of us even realize. Being that person, we've seen, they've been there for families who have lost family members. We have lost home visitors. It has been a period of extreme grief and loss, and the home visiting programs who are always there, they're adapting, they're bringing the heart and the resources that families need, have kept things together in our communities in ways that we will maybe never know, but we will hope to know and elevate those stories all along the way. I want to share, in New Mexico, home visiting has been something that has always been heavily supported by our government. And so we invest over $23 million between state general fund and what we call the Early Childhood Trust Fund. So after they created the department in New Mexico, the next year the governor said, well, we can't just create a department, we have to fund this department, and we have to make sure that it has the resources. So we created the Early Childhood Trust Fund, started with $300 million. It does grow based on oil and gas revenues and federal mineral leasing. As we all have seen, the price of oil, our fund is now estimated to be at $2 billion by next year. It disperses to the department 5% of that fund annually, and home visiting is always a priority year after year. So in the last 2 years, $8 million is coming from the fund itself to support home visiting, and we get almost $4 million from our MIECHV. We also are a state that has a Medicaid waiver. So we have nurse family partnership and parents as teachers as 2 evidence-based models that can be supported through the Medicaid program. And we have been working on this since about 2018. And it has, it's not an easy process, but I think it's been a lot of education and a lot of relationship and partnership building with our Medicaid managed care organizations and our Human Services Department, which is the Medicaid agency. We have strong collaboration in New Mexico, which allows us to do the kind of innovation that I can talk about as we move into Q&A. I think that's where I want to close and just, I think, give the perspective. The other piece I will say in our department, that the enabling statute that established us, the legislature said, we need you to do a 4-year finance plan. We want to really understand what it's going to cost to fully fund a prenatal to 5 system. So just last fall in November, we published our 4-year finance plan. And we worked with the Legislative Finance Committee, and we worked with other key partners to look at home visiting, not just as a one size fits all. And I know all of our states don't do that, but we work to understand the data of families in New Mexico to say how many are, we have 75% of our births are, I don't know why there's a dog in my office, but 75% of births are Medicaid births. But we further stratified that population because we want to make sure that the models that we're offering in our state are actually addressing the needs, the diverse needs of the families and children that live here. So I can talk more about that in our innovation, but I would say that plan is so wonderful. We worked with the prenatal to 5 fiscal strategies, and we're looking at both a universal touch with Family Connects is a model that we have brought to New Mexico, but also, again, looking at other evidence-based models that we most likely need to bring into the state to, again, address the needs of our families and to help them make the connections that they want to make within their larger community. So I will close with that, and I will turn it over to Chief Batten. Thank you.
Well, thank you, Madam Secretary, and it's an honor, and halito, and greetings from the Choctaw Nation of Oklahoma. And it definitely is an honor for me to be a part of this panel. And one of the things I just thought that I would start out with is just to, I don't know how many people's on this session in regard and knows about what a tribe is all about. And so just to let you know, the Choctaw Nation resides in the southeastern part of Oklahoma. Our reservation consists of about 11,550 square miles. We have about 208,000 tribal members. If you can imagine, on the eastern side, we have the Arkansas border. On the southern side, we have the Texas border. Anyway, the Canadian River on the northern side, and then there's a trail that divides us with the Chickasaw Nation on the western side. But the reason why I wanted to just give that geography to you is to excuse me, is to also let you know that we're in a very rural, very isolated, a very poverty-stricken area that we're trying to do our best to make it a better place to live for our families. But when you think about home visits, I'm not for sure that our people could really make it without home visits. And the reason why I say that is because our people are they're, those saying that there's a clan and a tribe, and we are very clannish. And so when we go into these rural isolated areas, our social workers, our people from our healthcare systems, people from our childcare, if they are not from that community, it is very hard to reach those people because trust is a major issue. Trust has been hard to develop through the years, I mean, from the federal government, as well as even from the tribe. And what I mean by that is because our families, believe it or not, being rural and isolated, when we finally get out there to them, then the issue is, are we able to even get in the door? Because I can remember even as a child, if somebody showed up to our house that we didn't know, we all went and hid in the back bedroom because that's just how scared we were of anybody from the outside. Were they coming to, do a census on us? Just what was the issue? What were they trying to do? And so trust is a very important part. And then once you're finally able to build a little bit of trust, then the other issue is to make sure that you do not judge people. So, for example, I go do home visits all the time. I ask my leadership team to do home visits because I think it's very important for us to stay connected with our people. But when you go out into those communities, and if you're not willing to sit down at their table, if you're not willing to sit down on their couch, maybe it's not the best couch in the world and so on, but you have to build that relationship. And so I just want to describe to you these rural isolated areas. It's 30 miles sometimes to the closest clinic. It's 30 miles to the closest grocery store. And so on. So again, we're very rural, we're very isolated, but again, it's critical that as we look towards going out and visiting with our tribal members, and looking at the comprehensive approach that we as a tribe, we try to do to them, we are their connection to the outside world, if you will. And what I mean by that is because we always have to look out when we go to them. Not only do we look at them from the health perspective, but what social programs, what health programs, all these types of services, housing, housing repairs. All these things are desperately needed for our tribal members. And, it makes me think about when we think about home visits. I've been with the tribe for, I'm working on my 36th year with the Choctaw Nation. By the way, I started when I was 12, but no, I jokingly say that. And the reason why I joke about that though is because it's taken a long period of time for people to develop that trust and to build the services and so on that we need to go into those communities. And when I was over our health system, it's been 20 years. We just celebrated 20 years of our outreach services to our tribal members, which we started with four social workers that started. And I think we have a little over 40 now in our social worker program. And that's just one piece of our outreach services to our Choctaw people. But I always talk about when we do this, and I cannot stress enough how critical, again, it is for these people that's developed a relationship with our tribal members and the uniqueness of that trust, that non-judging. When you go out there, I think about when we had COVID was happening, and they would not allow anybody to come to their home except our social workers, our community health representatives, our public health nurses, because it was mission critical that they knew the people that they could trust that would drop off groceries to them or drop off medical necessities to them. And so one of the things I think for me is just that we have learned through the years is as we go out and as we get to know more data is critical. The more needs, what are their needs? What are their barriers to success? And how do we get to them? We've been able to become more data driven as a tribe, which also makes us have performance-based outcomes. So we want to make sure that anytime that we look for federal grants or anything, we want to be responsible. We want to be accountable so that we can be assured to show that we are truly making the lives of our people better. I know I have to do that as the chief of the Choctaw Nation, but we want to show everybody that we're utilizing dollars. And when we think about the tribe, we had to be very creative. We've been blessed within the Choctaw Nation, where we have started economic development within our tribe, and we're again blessed, I would say, because we have the Dallas Fort Worth market, which is about 90 miles to the south of us. So they are starting to come to our area to utilize our resources and when I say utilize our resources, to help us make dollars, to put dollars back into programs. But healthcare, we did about 1 million outpatient visits last year. We do prenatal care, we do OBGYN services, we do all those things. But my point being is, if it wasn't for the tribe, we would really struggle to meet the needs because the federal dollars are just not enough. And even though we're trying our best to comprehensively pull all of tribal, state, federal dollars, all these private sector dollars all together to try to meet the needs of our people, it's really tough. And so the more that we can pull these programs and make them more comprehensive. For example, one of the things is that's a struggle for us is a lot of the federal programs is as you progress. So a lot of our tribal members, we help them finally get a home, and they're able to secure their family, that they start getting health care, they start getting jobs that we've provided and so on. Guess what happens? Then they lose their food distribution program. Then they lose their child care assistance because it's income based. And I would really like to encourage everybody to think about how do we have a progressive way to allow people as they progress with their income that they're still eligible for the critical need of childcare, because right now we have I was trying to remember the exact number of programs. We have 13 different Head Start centers located. We have or daycare centers located throughout. But my point being is, whenever they do that, and then we have to say, okay, you're finally working. Now you're going to get stuck with a $350 week childcare bill. So the more that we can make childcare available to them, and for us, I hope I'm being very sensitive to this when I said, because it's also reflective of me, is when the social education is very critical to us. And what I mean by that is as we look towards uh, trying to get education is going to be the key, is my point, because without that early childhood, without that daycare to give us that truly head start, it's going to be difficult for us to fit into society and to make sure that we progress and that we know the ways of the world as it becomes today. Because again, otherwise we're just going to know our communities and the rural isolated areas that we grew up in, that I grew up in. And so those are really important to us. And so one of the things I would just like to ask is, again, is childcare is one of the biggest needs of our people, that we need to make sure that those programs continue to be available to not only people that's lower income, but all people that's available, whether it's in our Head Starts, daycares, child care assistance programs. All of those are critical. We do need fair compensation of our child care workers, because it's critical for them to make sure that they can make a decent living. And so with that, I think that's mainly what the points that I wanted to get across to you all, and just want to thank you for allowing me to speak today. And I believe at this time I'm supposed to pass it on to Takoria Jones. Thank you for allowing me to speak today.
Oh, thank you, Chief. Before you go, I was hoping you would take a moment to teach us thank you in your language. I would really like to learn that word today.
It's Yakuki,
Yakuki, Chief.
a chukma, which means very good, as you pronounce that very well.
Very good. Achukwa. I like that. All righty, everybody. Good afternoon. My name is Takoria Jones. I'm here today representing Parent Leadership. I reside in Columbia, South Carolina. I'm part of quite a few networks of parent leaders. I was asked to join today to bring the parent leader perspective, and I hope I'm going to do that for you. And we'll definitely have some opportunity to talk in just a bit. What I'm going to talk about today are some additional reasons to do this work and ways to prepare for success in equity and in prevention. And we know how to do that, right? We start early. So thank you for this opportunity. And, let's get into this. So first, Nick is going to help me out by dropping a couple links in the chat. The first link is to childwelfare.gov. It gives some great guides and toolkits about having conversations, difficult start relationships, and how positive connections can be made ongoing. The Children's Trust Fund Alliance does a lot of work continually with lived expertise and agency partnering. So please do. Then there's a long list of the Alliance's resources, as well as quite a few other resources. So please do check that out. And thank you, Nick. The second one is from the CDC. It is the Injury Prevention and Control Department. Out of 2 decades of ACEs research, and I'm going to trust that, because I'm not a preacher and I'm not going to preach to a choir, but I'm going to trust everybody knows ACEs here. So out of 2 decades of ACEs research and data compilation, they've been dedicated to doing this work. So that second link will take you to the Injury Prevention and Control through the CDC. So why are we talking about that? Well, the CDC started the ACEs research, and just to kind of put some things in context about adverse experiences. 61% of adults across 25 states report at least one ACE. So like 50 states in America, so that's half the states, over half the adults. That's a lot. That's considerable. 1 in 6 reports 4 or more ACEs. So if you know 6 people, you know someone who has considerable health disparity because of their experiences, right? And of their research, 1.9 million cases of heart disease had the potential to be avoided by preventing ACEs. I'm going to say that number again, 1.9 million cases of heart disease. So do check out that link and what they're doing over there at the CDC. So how can we prevent ACEs and what they do? And Well, home visits, right? They decrease isolation, they promote social norms, um, they model healthy communications, relationships, and connections, and they connect people to people. So, right here, I'm going to take the opportunity to talk a little bit more with you all as home visitors. I know you all hear stories, and I know you connect to stories. So, I'm going to tell you a little bit about myself. I'm going to be really transparent here. Um, uh, this is my story of a home visiting program that saved my life. So, I caught a case, and pardon me if my language is casual, but I just want to talk to you. I caught a case, corporal punishment abuse, right? But my whole entire childhood, that's what I knew. I was 30 years old, was pregnant, single mother of three, was experiencing homelessness, and I was a convict because my car was broken and I needed some money, so I agreed to traffic some marijuana. And the biological fathers were a drug addict and a pedophile, and they were just like the paternal figures from my childhood. I beat my eldest with a house shoe, enough to leave significant bruising. She had clawed her sister's face, and we were living in a hotel because I was doing some administrative work. So it was a barter, so to speak. Um, my kids kept getting ringworms, and I was alone. It was myself and my children living in this very precarious situation. Instead of taking my children, they gave me a home visitor through a peer parent partner program. She saved my family. She when she looked at me, she looked me in the eyes earnestly. She helped me feel something that I had not been accustomed to, and that was empathy, self-worth, and connection. I wasn't just a nice black girl who spoke well and seemed to be intelligent. I wasn't just a poverty stricken woman who didn't seem to know how babies were made. I wasn't just a children's home graduate and an adult juvenile delinquent. I was someone who had seen barriers, challenges, and trauma, and not much of love, affection, and connection. But this home visitor, she could see that I was doing my best to show up and hold on to my life and hold on to my children. So that's how she approached me. She approached me lovingly, a loving approach, human to human. To work in human capacity beyond this current system structure and more so in the human system structure, a loving approach lands and fits so perfectly. Proper human development requires love. We are all humans after all. I'm often guilty of reusing a phrase that I heard and not recalling where I heard it. And if I ever do that, blame it on the head, not the heart. But this language is straight from the desk of the Associate Commissioner in the Children's Bureau, JD Schomburg, right? And as a matter of fact, I just witnessed her say it, share it, and live it yesterday. So we're talking about loving approaches at the federal level. Now, how do we get to a more loving approach, right? Well, parent leadership is considering what it takes to apply this loving approach to the workforce. The needs that go unmet there are unreal. Caseloads, expectations, the lack of attention to the value of the work of home visiting programs. It's astounding how it's like some people just don't get it. Frontline and supervisors, how are your relationships? Are they where they could be? Are you both feeling supported, capable, and knowledgeable enough to serve your caseload? Because these are the things you want to ask of families, right? Are you feeling supported, capable, and knowledgeable enough to be a strength-based parent, right? To protect and care for your children. How is your secondary trauma and resident trauma, how is that attended and how is that treated? And when I say resident trauma, I'm talking about that deep stuff. I'm talking about that stuff that just kind of reverberates. Maybe, you experience a home visit and now, red Hondas just do something. Like, I know that's pretty casual, but I don't want to get too deep in it because, again, resident trauma is deep. So just things like that. How is that attended for you all? Because as workforce, parents know, parent leadership recognizes that that's significant. And I ask this workforce mostly because your self-care isn't just about yourself. So I'm going to say that one more time. Your self-care isn't just about yourself, okay? What you're doing for yourself is coming into the work that you do with others. Your values aren't hidden away in some secret closet. Your mental model, your response mechanisms, they all make us who we are. So when we think about taking time to ourselves and caring for ourselves, we have to think about what what are our mental models? What are our response mechanisms and how did they get there? Because again, as workforce, these are the things that you want to help the folks we serve understand, right? This is what we want. So back to the loving approach. Let's consider those humans who need the most loving approach. According to the data, well, most of the people who are receiving interventions are pretty significantly Black and brown people, poverty income level, people who live at poverty income level, and LGBTQ plus folks. Now, when it comes to the level of loving, the level of need, where we see it most, well, we see it in communities that have and continue to have toxic stress and resident trauma. And these are the communities that have lived generations as humans displaced of culture and territory, as free and underpaid human labor, as humans bearing a social system built to destroy, and as humans who perpetuate a social system built to destroy. So I want to say that again. These are the communities that have lived generations as humans displaced of culture and territory, as free and underpaid human labor, as humans bearing a social system built to destroy, and as humans who perpetuate a social system built to destroy. Now, not saying anybody does that intentionally, but if we're going to look at what it is, I believe that's a fair statement, at least from my perspective. Trauma is a two-way street. Trauma resonates in all who bear witness to it, and even those who bear harm. And that is what restoration is, right? So when we're talking about prevention, we have to consider how we got there so we don't get there again. And again, that goes back to thinking about equity and historical marginalization, right? I know this is true. When I look at my life, I grew up with corporal punishment. I grew up um, with paternal figures who were not the best, and it exactly happened in my children's life. Like, this is not something I've guessed about. This is my lived expertise. Looking at my life, my childhood reached a 10 out of 10, and my history was revisited by my children. They all have at least 4, the same ones I had, but less because of that loving approach of the home visiting parent peer partner support provider. She taught me I could do things differently. She showed me by being able to look at me and show me that she could understand me and talk to me. There's no better connection than that. These days, what we're learning through data and experience and attention to our feelings is this. We must create a system where knowledge of historical and resident trauma elicits a loving approach. Home visiting helped me connect after, at that time, 15 years of lacking permanency. It decreased my isolation and it helped me learn healthy relationship patterns in a new toxic stress free norm. There's never no stress, like we get that, right? But it's a new toxic stress free norm. That's why I'm here today, to encourage and to bear witness to the work of home visiting programs and to encourage ways to come together with parents, because I'm a parent. That's why I'm here, because of my experience. And when you interact with parents and you think about ways to fund parent partner programs or ways to co-create with parent voice, this is what you're going to get. So I hope I have impacted you in some way today, and I do look forward to the conversation.
Remarkable. Thank you so much, Sequoia. And I'm actually going to start our question and answer with you and what you left off talking about. We're going to turn it over to other panelists in a minute. We're going to talk about innovation and breaking down silos and connection to other programs and blending funding streams and systems building and all these really important things if we're going to be moving these big programs forward. But I think what you said was really powerful in that if we're going to be talking about prevention and building things, we have to think about how we got here. The empathy conversations, the connecting that you've identified. If we're going to turn our conversation and the loving approach, if we're going to turn our conversation now to thinking about how to build a better system, particularly with home visiting and its connection to other programs, how do we bring that parent voice in? How do we bring what you have really done such an amazing job in highlighting to those conversations and make sure we're doing that in a powerful and impactful way?
To be prepared to hear voice, that takes a minute, but the preparation is necessary because, right, be prepared. And when you can be, there are lots of resources and organizations out there, from the CB to the Alliance and, all over the place that you can get assistance of friends. There's all kind of things that you can get into, to help strengthen that muscle, because it's a shift. And parents who are ready to step up, have often networked, have found a subject of expertise that they feel comfortable in sharing, and then together that partnership really goes a long way. But the preparation on agency and lived expertise is paramount, because beyond that, if you don't have the framework, the relationship's not going to last. And it takes both of you to build that framework. So just being ready to have the conversation.
Ready and asking. So thank
There
you
you go.
so much. Chief Batten, you talked a little bit about the connection to other programs. The progress, I think, is how you phrased it in your remarks. And can you say, and others on the panel touched on this as well, the connection to other programs, how we're working together. I know we're going to definitely hear from Secretary Gerginski and Melissa a little bit about that too. But can you say a little bit more about what that looks like? I mean, childcare right now we're hearing and reading about on a daily basis, and hopefully Congress can do something to help address that crisis. But any more that you can say about how you do that to kind of break down some of those silos across programs?
Well, I can tell you in regards to the service delivery and making it available to our tribal members, for us, when I say us, I almost consider myself a social worker, but it is that we have to educate ourselves, first of all, because there is so many different program guidelines for each particular program, and trying to help our tribal members. And of course, they get frustrated because they have to fill out an application for Head Start, for daycare, for housing, for all these different things, and it becomes so burdensome. And I think Decoria mentioned it correctly. You finally get somebody that's ready and they're willing to step forward, and then you almost put these barriers. And so we our social workers, all of our people that work out in the field, our outreach workers, they have to really be educated to help them navigate. You truly would use the term, they are navigators for our tribal members, because again, they're trying to navigate and they don't know how to go through this complicated process. I mean, I'm going to be like Corey. I'm going to be just open and honest here. I can remember when I went to college, I did not have a clue. My parents had never went to college. If it wouldn't been for my school counselor showing me how to fill out for a Pell Grant, I didn't know what Pell, I didn't know what all these terms, you got to go do all your testing and all those types of things. But my point being is it's extremely difficult. We've been very successful because we have made an effort to, like I said, we put 40 social workers out in the field, as well as I think about our Chata Ala Apila program that helps with our parenting programs. Our public health, all these things, the tribe we've committed to, but it is extremely difficult. The more we can align these program guidelines and things so that it's easier for our people to access these programs would be a huge benefit and break down a huge barrier for our people.
Thank you, Chief. Secretary Griginski, you kind of teed up where we're headed and a little bit of a conversation with you about innovation. But the other thing that I heard a lot out of your remarks, but also others, is the importance of leadership, of prioritization from leadership, as well as investments for sure. So with that, I didn't want to lose that because it was a big takeaway for me, particularly, and I know something we all know, but it's always great to hear. But if you could say a little bit more about the innovations that you're seeing and hope for, particularly as they connect back to this, and Medicaid funding as well, I know is a big issue on your plate. So I'm going to let you kind of pick up where you left off, I think.
Thanks, Sarah. I think, to Coria's story, shed so much light on like why we knew we needed to change the way we were doing things, because you have to meet families where they are and you have to support those home visitors, as she's describing, in all the ways that, they have the reflective supervision, they have the opportunity to learn and to be supported. And so one of the first things we did, and again, we started a cost modeling for home visiting to see what does it actually cost. And so we turned to our home visiting programs because it had been a really set rate per family. And we said, give us a budget about what it actually takes to serve the families that you're serving in your community. What's the intensity? We had a lot of different complications, to the chief's point, and programs were spending a lot of time with the financial back office and not the front, which we've seen with childcare too. So we partnered with an administrative service organization to give our home visiting money there. And we were able to set up contracts with home visiting programs within 24 or 48 hours. And it's based again on what are their needs. They may be serving families who have high intensity needs, and then they're moving forward and they don't need as much. So we're able to really work in a more seamless way through that innovation. And we increased our base rate immediately by $1,000. It's still not high enough, but we recognize that programs were designing their services based on what they had, which is what we see in the prenatal to 5 system, historically underfunded, resulting in low wages, mostly done by women of color. And so we said, we have got to right size this. And that's where the 4-year finance plan came in. But those were some of the innovations we did to address meeting the needs of families in each of the unique and diverse communities across New Mexico.
Thank you. Melissa, you also touched on the connection to the programs and appreciate the leadership of this administration for sure in all of this. Hoping you might be able to talk a little bit more about innovations you see across programs as well in systems building, but also where policy and decision makers can improve in partnering with families around this change.
Thanks, Sarah. Yeah, it's interesting to reflect on. I mean, I think there is something to be said about definitely listening and using parent and family voice and lived experiences in informing the policy levers that can happen. But I also see that the opportunities are making sure it's embedded in the policy to begin with. So I point to, Head Start, obviously that sort of has, parent leadership, parent engagement kind of baked into the requirements of the program. And I do feel like some of the opportunities now is there's the timing and the openness in this administration that's really talking about the value of that. Coria was talking about Aisha Schomburg at the Children's Bureau that's really leading a lot of work around equity and really ensuring, lived experiences are doing that work in the Children's Bureau. It's a similar process that's happening across ACF. We just released a strategic plan that's really has several strategic goals. And one of them is about advancing equity by reducing structural barriers including racism and other forms of discrimination. The first sort of bullet under that, and I'll put a link to it, is centering and integrating the perspective and experiences of program participants in the design, management, evaluation, and decision-making of ACF programs and operations. I think it's easier said than done is one thing. I really am so excited to hear, states like New Mexico that have really started to do that. We're trying to embed that process. As Takoria knows, we've had this national group of parent organizations and parent leadership that's really been helping provide feedback to ECD, actually, and really also providing feedback into the ACF strategic planning efforts. But to really create a structure like that can be sustainable and that's an ongoing feedback loop, I think is really critical. So that's where I think I would say there's innovations with certain offices, with certain programs in certain spaces. And I think the next step for us at the federal level is to really make that probably more consistent across. Because I think Chief Batten, what you're also saying, I feel like, we hear that again and again, not just in tribal programs. It's like, it just has to be easier to really kind of use money across. And it requires having it in the policy and the guidance, but also having it embedded in the way in which federal project officers and federal staff kind of work with grantees to make it easier, and also incorporate the places in technical assistance and monitoring and guidance where that voice can be embedded there. I hope that's helpful, and I'll stop there.
The intentionality is really important. So I'm going to be mindful of the clock. We have about 4 minutes left. So I'm going to ask one question of all of you. And Melissa, since you're still on screen, I'm going to let you go first, if that's okay. I think it's, rapid response of what is something you're hopeful for going forward, particularly around home visiting, as well as, if there was a wish that you had, what that might be. So we're going to start with Melissa and then just kind of go through as we did before, turn it over to Secretary Ginsky, Chief Batten, and then to Corey, we're going to give you the last word.
Yeah, I would love for home visiting. I mean, I think the vision of home visiting is really to be part of that early childhood system and be at the same settings and tables and thinking about the seamlessness between home visiting, early Head Start childcare, early childhood programs. I think to be realized in a much more seamless way, I think would be great. That would be a hope. So.
Thanks. I would say, and we are doing that in New Mexico. And again, it's because we have this cabinet level agency that brought all these prenatal to 5 programs together. And I would say that working, at the federal level to remove barriers to families' participation and how those funds can be more flexible, used to blend with state funds or local funds or private sector funds, and be able to do the same quality work and meet the needs of families. So I think we need more flexibility, particularly in the home visiting at the federal level, to allow states to build comprehensive home visiting systems.
Sarah, I think some of the same things is just the deregularization, if you will, of how do we remove barriers so that we're able to utilize all the resources to help propel our tribal members forward, our constituents and so on. I think one of the things for me is also just decentralization of programs. That's something that we have learned is, we have our headquarters here in Durant, but the more that we have put our social workers out in the field and we put offices in the communities where they are, it helps grow economically that area. It helps people to build that trust, that relationship, so they're non-judgmental, all those types of things. I think the more the federal government can push that out and be actually in the communities, I think would be a huge help. And of course, for me, we have to give our future a good shot in the arm. And what I mean by that is truly focusing on early childhood, focusing on childcare, so that we can make sure to give those kids the opportunity to be the people that they want to be for the future.
Well, I really think that from my perspective, I think more specifically talking about certification, training, and even second chance programs for bringing home visiting to the community level, and really like fleshing and filling all those gaps that we find at those micro levels. So, that might even look like, we're talking big things, you know, deep commitment to putting the money where the mouth is, pretty much when it comes to equity and restoring margins. And when I talk about margins, it's time to reduce a margin that we can, and that's the margin of fellowship and the margin of connection. And home visiting does that. And so if we can reduce that margin with home visiting, let's do it. And let's continue to prioritize it and continue to notice that those that are closest to the problem more than likely have a pretty good idea of how to fix it. So thank you all.
Thank you. We couldn't end it any better than that. So really, a thank you again to the panelists. I know if we were all in person, there'd be lots of applause. And we only barely scratched the surface of what we need to know. So thank you.
Sarah, just one thing, if you don't mind, is in Choctaw, we use the word Chapisa la Chiqui, which means there is no goodbyes in Choctaw, and Chapisa la Chiqui means until we see each other again.
Brilliant.
Brilliant. Thank you so much, Sarah. Thank you so much for moderating and leading that panel. Thank you to Coria, Chief Batten, Melissa, Secretary Groginski for joining us today. I don't know if y'all are keeping track of the chat, so I will just say thank you all. I think people are feeling very inspired and moved, and so I'm grateful to all of you for the work that you are doing as leaders at the local, state, federal, and with our tribe. So thank you all so much. That was amazing. I think we're coming off of 2 amazing plenaries with lots of inspiration, families and communities at the center, and leaders at all levels who are speaking their truth. So thank you all for everything that you do. A couple of quick reminders before we finish up for today. A great first day is please again, help us out and fill out the end of session survey. Nick has just dropped it, or Megan has just dropped it in the chat box. So please click on the link and complete that. We really want to hear from you about how this worked for you today, how the day was, what do we need to do better. One quick announcement following up from this morning's plenary. I think folks will be excited. We're gonna, Jessica Goldberg and Melissa Colon are gonna be hosting a follow-up workshop tomorrow. They're going to take a deep dive into the community evaluator role and will answer questions. The session is titled Using a Community Evaluator Model to Promote Equity in Evaluation. And that is going to take place tomorrow at 2 p.m. Central, 3 p.m. Eastern. So if you want to get into the conversation deep, please keep a lookout for that as you try to plan your day. Couple of quick things. Remember that right after this session, you can either join on instant networking or join a discussion table to just have more conversation about what you heard today. I was tracking the chat, lots of inspired folks out there. So please make sure that you connect with each other. As we get into tomorrow morning we start with yoga at 9 a.m. Central, 10 Eastern. So please feel free to join that piece. And you can also join an instant network as well at 9 a.m. Central, 10 Eastern. I'm sure there's going to be a lot of feelings and processing that's going to be coming up overnight. So tomorrow morning will make for great conversation. And I will see you all back here tomorrow morning at 10:30 a.m. Eastern for our plenary session of the day. So thank you again, everyone, for sharing your time with us today. We really appreciate you being here. I want to give a shout out to everybody who helped out today, all of the Start Early team, as well as our partners at Zoom, our partners who have helped with the funding, just everyone. Thank you so much for your support of home visiting and of the summit. We know that home visiting works. So have a wonderful evening. Go back to your lives, share something new with somebody who wasn't able to join today, and we will see you all tomorrow. So thank you so much and have a great afternoon.